Ethics in general deals with the fundamental questions of how we should act and how we should live. Ethicists argue about individual rights and responsibilities, about our obligations towards others, and what makes an act morally right or wrong. They also think about the social structures and institutions that shape how we act as individuals, and how we should design those institutions in ways that are fair and just. Now, bioethicists do all of this in the context of biomedicine, healthcare, and health policy. They ask questions such as, is it ever morally permissible for a clinician to kill her patients? Should we use medicines not only to treat disease, but also to enhance cognitive function? Who should get a kidney transplant if 3 patients need one, but there's only 1 kidney? It's these sorts of questions that bioethicists get really excited about.
Our students are an international group. They come from all over the world, and they come from a variety of backgrounds. So we have students who've come from social science backgrounds, from humanities backgrounds, and from medical backgrounds. And we also recruit students who are from the sciences. So we have neuroscientists, we have geneticists, students who've done a broad base of science who are interested in the bioethical questions that grow out of their science degrees. And we also recruit health professionals, so nurses, doctors, people again who are looking to have an ethical insight into the kind of work that they do.
The Master in Bioethics and Society is taught jointly by the Department of Social Science, Health and Medicine and the Centre of Medical Law and Ethics here at King's College, London. It's a 1-year program for full-time students and a 2-year program for part-time students. There are 2 core courses, one on ethical theory and medical ethics, and one on social and ethical controversies in biomedicine. These courses equip students with the knowledge of key ethical and bioethical theories and debates, and also hone their skills in analysis and argumentations. In addition, there's a wide range of optional modules that students can choose from to explore some issues in more depth, such as justice in health and healthcare, or ethical issues in global health. Students will also write a dissertation on a topic of their choice under the guidance of a member of the department, and there will be a range of workshops on methods in biomedical ethics to help them as they write their dissertations.
King's has a very active future careers program, so students who come here can expect to get quite a lot of support in thinking about where they will go after the program finishes at King's. Our students will go on to do academic research in social sciences, or in philosophy, or in law. They will also go on into public policy positions. They could join NGOs. They could go on to work in law firms. They could also go on to work in health and hospital administration. So there are a lot of options for our students coming out of this program.
Bioethics is traditionally a branch of applied ethics, where moral philosophers apply their particular theories to specific problems that arise in biomedicine and bioscience. But over the past decade or so, bioethics has really become a thoroughly interdisciplinary endeavor, where philosophers are joined in the debate by social scientists, lawyers, policymakers, clinicians themselves, and other people. So social scientists in this debate have a particular role to play because they have the skills to study how ethical problems arise, in which sort of context they arise, how people reason about these sorts of problems, and what are the common moral intuitions about common problems, as well as what the implications of certain ethical positions might be. So the challenge for social scientists conducting bioethical research is to integrate their empirical work with the bioethical debates and argumentation as well. And this is what we're doing here in this Department of Social Science, Health and Medicine, and this is also what we will be trying to teach you as a student in the Master in Bioethics and Society.